Gentlemen, a quick question. Why does a curable infection, gonorrhea, so often become the quiet on-ramp to HIV? According to the CDC, more than 2.2 million new STI cases were recorded across the United States in 2024, and gonorrhea remains one of the most stubborn. Rectal infections raise HIV risk anywhere from 2 to 17 times, and in some follow-up studies, about 1 in 15 men became HIV positive within a year. Symptoms gone does not mean risk gone. Inflammation from gonorrhea can leave microscopic openings that invite the virus to enter. This story is real if you or someone close has ever faced that silent infection. Each man's habits and health differ, so when we reach the "listen to your body" section, you'll recognize what truly fits you. Stay with me. Today may reset how you protect yourself for life. If this topic speaks to you, hit subscribe and comment "Learn About." One click moves us toward 1,000 supporters so we can help more men. In the Solutions segment, I'll reveal the hidden factor that separates recovery from lifelong risk. In the next 60 seconds, you will grasp the real definition of this condition. It looks ordinary, yet in my clinic it is serious because knowledge and up-to-date guidance decide outcomes. Before we talk about HIV, let's face what gonorrhea actually does after the burning stops. Gonorrhea is caused by Neisseria gonorrhoeae, a bacterium that attaches to delicate mucosal surfaces. It triggers microinflammation and microscopic tears in the lining. Those tiny breaches become an open door for other pathogens, including HIV, to cross. Many men stop antibiotics as soon as the sting eases. Symptoms recede, weekend plans return, and the mind files the incident under "handled." But stopping early leaves residual inflammation smoldering beneath the surface. Tissue appears calm, while defensive barriers remain thin, fragile, and easily disrupted. Locations easy to ignore include the throat, rectum, and the urethra. Throat and rectal infections are often quiet. A man may notice only a scratchy swallow, mild itching, or nothing at all. The urethra can also pass through silent intervals, especially after partial treatment. Here is a typical case from practice. A 28-year-old had burning urination and discharge for 3 days. He bought pills online, took them briefly, felt better, and stopped. 2 weeks later, he resumed sex. His discomfort never fully returned, but low-grade inflammation persisted. When we scoped the urethra, the mucosa looked blotchy and friable. Cultures were mixed and inconsistent, yet the tissue clearly had not recovered. Reduced symptoms do not equal recovered tissue. Pain fades faster than mucosa repairs itself. Inflammation can linger for weeks, keeping those microscopic gates ajar. During that window, any exposure with virus present has a better chance at entry because the body's first barriers are compromised. This is why retesting and full-course treatment matter than pride. So, if the pain fades in days, what remains for weeks is the real danger. It's not what burns outside, it's what silently opens inside. Don't stop. If you are still watching, listen closely to this part. With 1 minute of focus, you will gain what many men told me they wish they had known sooner. Experience distilled into clarity. Let's step inside the tissue, where inflammation quietly rewrites your risk. Acute gonorrhea ignites an inflammatory cascade that erodes the epithelial barrier and exposes target cells. As junctions loosen, HIV finds adhesion points, and local CD4 T cells concentrate near the breach, turning a wound into a landing strip. Many young men sit in my office and say one phrase: "If only." If only a doctor had explained that reducing pain is not the same as restoring mucosa. If only they had finished treatment, waited for healing, and retested on schedule. Picture a fortress wall after a storm. Hairline cracks thread the stones, the gate still stands, but it takes far less force for an enemy to slip through. That is inflammation. Not dramatic, but decisive. Moist, high-friction sites such as the rectum and the oropharynx endure persistent micro-injury, making those cracks slow to close. Even when discharge fades, microscopic edema and friability can persist for weeks, especially after partial therapy or repeated exposure. Add reinfection and the damage stacks. Inflammation does not reset to zero. It compounds like interest. When the wall cracks, it's not the invader's strength. It's your defense that decides the outcome. This is the immune math we rarely teach. More exposed target cells plus thinner barriers equals higher probability of entry per exposure. One encounter may pass without consequence, but the odds subtly shift each time inflammation lingers. That is why I care less about dramatic symptoms and more about time, healing, and adherence. Finish the course, rest the tissue, hydrate, reduce rubbing and friction, and schedule retesting before full activity. The danger isn't the bacteria. It's the immune chaos it leaves behind. Ask most men why they didn't test early. The answers are painfully similar. Doctor, I'm embarrassed if anyone finds out. I was afraid of being judged. I thought the symptoms would fade by themselves. I hear these lines weekly, and I feel the weight behind them: shame, fear, and misplaced pride. Let me speak to everyone, not just one man. Please do not stigmatize. Replace whispers and side glances with one word of encouragement. A single message of respect can change the decision a man makes tonight, and that decision can change his health for years. Here is the clinical truth. 3 barriers drive delay: shame, fear of judgment, and false confidence when symptoms ease. And 3 consequences follow: late treatment, transmission to partners, and a repeating loop of reinfection that erodes trust and health together. Strength is not pretending nothing happened. Strength is responsibility. Early testing is not a confession of guilt. It is care for yourself and for the person you love. When a man tests early, he cuts delay short, shortens inflammation time, and lowers the odds that HIV finds a door. Be honest with me. Did any of those reasons just describe you or someone you love? If this stings a little, let it guide you, not shame you. Book the test, finish the treatment exactly as prescribed, and protect your partner. If this part touched you, comment, "I choose awareness," so another man sees your courage and follows your lead. Your future self will thank you. Your partners will feel safer. Your community grows stronger. Silence doesn't protect you. It only protects the infection. And remember the lesson from the tissue we discussed moments ago. The danger isn't the bacteria. It's the immune chaos it leaves behind. Delay feeds that chaos. Honesty calms it. Choose the path that brings you back to health, respect, and peace. Starting today, many couples sit in my office with the same tremor in their voices. We hear the worry before the words. Gonorrhea rarely travels alone. It often brings company: chlamydia, trichomonas, and herpes simplex virus. Each adds fuel to inflammation, stacking irritation, micro-injury, and fragile mucosa on top of one another until defenses thin. When inflammation repeats, tissue never gets a full night's rest. Edges that should knit remain open. The clock resets to 0, but the wound does not, and risk multiplies in the background. This is why a man's symptom diary can look like flickering lights: better this week, worse the next, then quiet again. The biology is not indecisive. The tissue is tired and not fully repaired. Pain in one testicle often sends men to urgent care. We examine and find epididymitis, a swollen, tender cord behind the testicle, frequently tied to untreated or undertreated gonorrhea or chlamydia. Leave it long enough, and fertility can pay the price. Partners ask, "Which one of us started this?" I shift the question gently. The more powerful question is, how do we close the loop together? Treating both partners simultaneously is not blame. It is engineering. It removes the ping-pong effect that keeps infections alive. Remember the blind spots. Throat and rectal infections can carry high loads without dramatic signs. A scratchy swallow or mild itch may be the entire headline, while the real story is ongoing inflammation where friction and moisture are highest. If you have treated the pain but not the pattern will treat you back. Short courses, shared towels, unhealed tissue, and resumed activity too soon are the rungs of a quiet ladder that climbs toward bigger problems down the line. What hides beneath one infection can awaken another. Close the loop, test broadly, treat completely, allow tissue to heal, and your nights begin to feel quiet again. For both of you. Here's the clean, simple protocol that stops the spiral. Congratulations for getting here. Find a quiet place and listen, because I will go fast and keep it clear. This is the framework I use when men need results, not noise or shame. Step 1. Test early and retest smart. Order a combo panel for gonorrhea and chlamydia. Add trichomonas or HSV based on exposure sites and include HIV testing. Retest at weeks 3 to 4, again near week 6, and at 3 months, adjusting for risk and symptoms. Step 2. Treat completely. Follow guideline dosing without shortcuts, even if burning fades. Avoid self-medicating or stopping early. Give the mucosa time to knit. Resume full activity only after symptoms settle, and follow-up testing confirms clearance, not merely after a comfortable day or two. Step 3. Tell your partner or partners. Treat in parallel to remove ping-pong reinfection, and this is engineering, not blame. Transparency rebuilds trust, shortens the infectious window, and prevents that tired cycle of relief, relapse, and regret that so many couples describe months later. Now I will fulfill the promise from the opening. The hidden deciding factor is post-treatment inflammation control. Antibiotics close the case, disciplined recovery closes the door. Sleep 7 hours, hydrate, cut alcohol and smoke, and use zinc, vitamin D3, and omega-3, while gentle barrier care restores the lining. Ignoring this step leaves tissue thin even when pain is gone, and the door stays cracked. Micro-injury persists under the radar, and probability per exposure rises. No supplement replaces adherence and time. These measures support, they do not substitute. Consistency is quiet medicine. It pushes risk back down. Antibiotics close the file. Inflammation control closes the door. Healing isn't just antibiotics, it's the discipline after relief. If this framework helps, drop a word of encouragement so we can open the next, deeper segment together, the part that locks in immunity and long-term peace of mind. Now, let's lock in your recovery so it actually lasts. I've given you the blueprint. These refinements keep results from fading. Short, simple, and decisive, because bodies respect routine more than fear-driven bursts that disappear after a week. Pillar 1 is sleep. Aim for 7 hours. Deep sleep recalibrates immune signaling, tightens epithelial junctions, and lowers baseline inflammation. Keep a regular bedtime, dark, cool room, and put your phone away 30 minutes earlier. Consistency beats occasional perfection. Pillar 2 is hydration. Fluids support mucosal turnover and dilute inflammatory byproducts. Start with a glass on waking, carry a bottle you like, and spread intake through the day. Alcohol and high-sugar drinks add friction to healing. Dial them down while tissue repairs. Pillar 3 is anti-inflammatory food. Build plates around vegetables, legumes, whole grains, fatty fish, nuts, and olive oil. Favor color and fiber. Anchor 2 meals. Crowd out ultra-processed foods rather than forbidding them. The goal is lower inflammatory tone, not purity. Pillar 4 is micronutrients. Vitamin D3, zinc, and omega-3. They are supports, not substitutes. Pair with food, confirm dosing with your clinician, avoid megadoses and track trends every 2 weeks. Energy, sleep quality, and skin comfort guide adjustments better than anxious guesswork. Protect the barrier you just repaired. Use gentle fragrance-free cleanser, rinse, pat dry, then light moisturizer. Avoid harsh soaps, abrasive scrubbing, very hot water, and tight non-breathable fabrics that trap moisture. Give tissue true downtime between encounters. Rest is therapy. Plan follow-up testing. For most men, every 3 to 6 months is sensible. Test sooner with new symptoms, partners, or exposures. Recheck after any treated infection before full activity. Think of tests as dashboards, not verdicts. They let us steer early and quietly. Consistency is boring, and that is exactly why it is powerful. The immune system loves rhythm. Put these low-drama habits on autopilot and risk quietly drops while confidence returns. Your immune system is the real doctor inside you. Feed it well. Real intimacy starts where secrets end. Many complications I treat are not purely biological. They grow from silence and guessing, while a 30-second talk before intimacy can spare weeks of treatment and months of worry. Have the talk up front. What are our boundaries tonight? What protection are we using? When was our most recent test? And what symptoms have we noticed or treated? Because clarity turns a vulnerable moment into a respectful plan. Name the limits you need and ask for theirs. Then agree on a pause word, a cleanup plan, and what to do if anything stings or bleeds, since a shared script makes it easier to stop early without anyone feeling accused. Schedule testing together like a gym session. When you go side by side, trust rises, reinfection drops, and the relationship strengthens, because evidence replaces suspicion and teamwork replaces blame. If one partner tests positive, pause together, finish treatment together, and get the all clear together, as ping-pong infections usually reflect a communication gap rather than bad intent. Remember that asking for testing is respect, not rudeness. It says I value your body and mine, and I want us well next month, not just tonight. If you worry the talk will kill the mood, rehearse lines when clothed and calm, and you will find each conversation faster because repetition builds comfort and dissolves awkwardness. If someone is worth your desire, they're worth your honesty. Speak plainly, especially if you are anxious, because vague words invite vague boundaries, and precision protects you both when emotions and dopamine run high. Keep a shared note with last test dates, results, and medicines. Systems prevent big misunderstandings, and turning health into routine removes shame. When honesty enters the room, fear leaves. If you believe candor heals, subscribe and share this with the person you want to protect, so you can start safer conversations tonight and a safer life tomorrow. Prevention isn't a moment, it's a lifestyle. I want you to build habits that keep working when willpower is tired and emotions run high, because sustainable safety isn't a rule you memorize but a rhythm your body repeats. Redefine SAFE as 4 linked actions. Prepare, protect, check, recover, and do them whether anxious or calm, because consistency beats mood, luck, and promises made in the dark. Preparation is planning setting, supplies, and timing. Protection is barriers and lube matched to the act. Checking is scheduled testing. Recovery is rest, gentle cleansing, and time for tissue to repair. Use a simple decision matrix so choices feel less dramatic. C. Observe the situation clearly. Sense. Scan your body and boundaries. Scan. Test when risk occurred or timelines say it's time, even if symptoms are quiet. Write this matrix where you live, in a bathroom cabinet or beside condoms and lube, so the path to safety is visible when arousal narrows attention and memory gets selective. Ritualize downtimes after infection, sports chafing, or any irritation. Inflammation takes time to settle, And giving tissue quiet days prevents the invisible microtears that turn rare risks into likely ones. Anxiety drops when knowledge rises. Learn the timelines for HIV and common STIs, and you will replace late-night spirals with practical steps, such as book test at 4 weeks, repeat at 6, confirm at 3 months. You don't have to be perfect, you have to be regular, because small, steady actions beat heroic bursts that vanish in 2 weeks and leave you exposed again when you feel safe. You don't have to be the strongest, you just have to be the most consistent. Build shared systems with partners, calendars for testing, phrases to pause, and a cleanup plan. So care becomes teamwork, and nobody carries the burden alone. The smartest shield is the one you wear every day. Here's what today really means for you. Gonorrhea is not merely a brief irritation. It opens the gate for HIV by driving inflammation and microscopic injury in the mucosal lining. When those first barriers thin, the virus needs far less help to cross inside and take hold. Feeling better is not the same as being healed. Symptoms can fade in days while tissue recovery lags for weeks, and reinfection keeps resetting the clock. That loop is dangerous because each flare invites fresh microtears and more exposed target cells on which HIV can attach. Real protection is practical and repeatable. Test on schedule, treat completely, control inflammation, rebuild immunity, and communicate honestly. Testing turns uncertainty into a plan. Full-course therapy closes the case. Inflammation control and immune routines keep the door shut. Honest communication prevents ping-pong infections and strengthens trust between partners. Replace fear with clarity. Replace silence with action. Fear freezes, but clarity moves you toward the next right step. Booking tests, finishing medication exactly as prescribed, hydrating, resting fragile tissue, and aligning with a partner who values health as much as chemistry, pleasure, and desire during real-world moments when judgment can slip. Your life is not a roulette table. It is a system you can design. Choose rhythm over drama and consistency over heroic bursts. Small, steady habits lower risk quietly, rebuild confidence, and give tomorrow less chaos and more control than yesterday. Prevention is a lifestyle, not a lecture or a threat. If you learned one thing today, let it be this. Awareness doesn't make you weak. It makes you wise, and wisdom saves lives. Make that wisdom visible. Subscribe and add your voice so this message reaches the next man who needs it, and a community that protects each other grows stronger. Starting right now, together.